A proposal that would expand access to opioid overdose treatment is gaining momentum at the state level.
The bill is heading to the Assembly floor after being approved by 2 committees. Ground 4's Gayle here in the studio with the details. Gayle.
Ken and Catherine, AB 663 would allow jurisdictions to operate a mobile pharmacy that dispenses medications to treat the opioid addiction. The goal is to expand healthcare access to those who are struggling with the addiction but can't get the help they need.
We have to make it a lot harder for people to access fentanyl and a lot easier for people to access treatment.
State Assembly member Matt Haney announcing state legislation addressing the fentanyl crisis. AB 663 would allow mobile pharmacies to carry a medication to treat opioid addiction.
Buprenorphine, also known as Suboxone, is the most effective treatment for opioid addiction. It is shown to reduce mortality or the likelihood of overdose death by over half.
But access to that treatment is limited.
Many pharmacies don't carry this at all. So this will, for the first time in our state, make it legal to carry that medicine in a mobile pharmacy that will allow us to go reach people where they are.
Haney's measure is getting the strong backing of San Francisco leaders. Mayor London Breed says the bill would provide service to those who don't have health insurance.
It is going to be a game changer for how we provide support with our street medicine team and other entities that are out there, our street crisis response team and people who are on the ground trying to get people help and get them into services.
San Francisco's Health Department Director Dr. Grant Colfax also supports the bill, saying the measure caters to underserved communities.
I don't know about you, but I could really use a mobile clinic myself sometimes to go refill a prescription. It can be a pain. You're busy. You have lots of other things to do. There are other priorities. And for people just trying to survive, a mobile clinic could make a huge difference.
Dr. Colfax adds last year, 647 people died from accidental overdoses in San Francisco. 70% of almost 3/4 involved fentanyl.
What's happening in San Francisco, people are saying, why aren't we doing anything? Why is this person laying on the sidewalk? Why aren't we helping people? And why are the drug overdose deaths continuing to rise? Well, a lot of the laws that need to change happen at the state level.
And if Assembly Bill 663 gets signed into law, it will go into effect January of next year. Gayle, Ground 4 News.